diagnosed. I used to be very thin talaga. Thin, with regular menstruation.
Okay.
But late 2015, sometime around December or November, I was diagnosed with PCOS. That time, ang PCOS, hindi pa siya basically well-explained. Dito na si PCOS nag-strike sa health ko. Nung nag-start akong mag-breastfeed, tapos in-stop ko na lahat. As in, kasi syempre, when you're breastfeeding, hindi ka pwedeng mag-diet. Kaya din siguro, I started having hypoglycemia, especially ng afternoon. Tapos, yung weight ko, as in, ang laki ko, I started gaining weight. Super drastic yung pag-change ng weight ko from size 2 to size 8. As in, ang laki. Tapos, ang baba na ng confidence ko. Sabi na ng mga brother ko, mukha na daw akong aparador, mukha na daw akong gasol. Aside from the hypoglycemia, drastic weight gain, meron pa akong migraine, chronic migraine. Mainit, malamig, whenever I'm stressed, ang sakit. So, parang binabasag talaga siya. Nahihilo na ako talaga, nagsushoot up yung blood pressure ko. Kahit walang trigger.
How did you come across Simply Nature PPARS?
Nalaman ko siya through Ma'am Jocelyn and Sir Jhen. So, they introduced PPAR to me kasi one time we were having lunch. So, very big yung appetite ko. Akong excusin, Ma'am, always tired meal. Ako, he looks 30s, 20-something, mga ganon. So, sabi ko, gusto ko ako din. Kailangan, paglaki ng anak ko, mukha lang kaming friends. When I started using PPARS, first month pa lang. Actually, first week pa lang, I started texting them na, Sir Shyan, Ma'am Jocelyn, I don't have episodes of migraine at all. Kasi yun talagang kita ko. Kasi everyday, nafe-feel mo eh. Wala, even if it's cold, it's hot. Yes, kasi sabi nilang, hirap daw, sabi ng doctors, once you got diagnosed with DM2 or diabetes, it's really hard na i-reverse.
Exactly. How did your doctors react?
They were amazed yung OB ko. First time, kasi OB ko na sila before pa eh. So, first time, since 2015, kahit ako, first time naming makakita ng clear, normal.
Guys, just to let you know, as you can see on your screen, the result actually says ovarian is bilateral. So, both sides.
Yes, bilateral. More than 20. Tapos may specific size pa siya. I can share naman yung lab result. Tapos ngayon, left is already clear and normal. Tapos yung right ko, reduce na yung size. So, working on it para ma-clear na siya. Sir, first of all, I wanna thank Sir Shyan and Ma'am Jocelyn. Really, as in, sobrang thankful ako sa kanila. I thank God for their lives. I have nothing but gratitude for them. Having this product improve my way of life talaga, as in. Tapos more pa para yung ibang friends ko, actually nakikita na rin nila eh. Encourage ko na rin sila, medyo nire-refer ko na rin sila. Tapos, kaya mo rin to.
Exactly. And just like how Sir Shyan and Ma'am Jocelyn did it to you, it wouldn't be hard anymore because they see the improvement, they see the result on you as well.
Living witness na sila eh, kung ano yung nangyaring changes. Good morning, I am Monique B. Marzad, 31 years old. I'm currently working as a property manager here in BGC. I was diagnosed 2015 with PCOS and I started gaining weight, having high blood sugar and then high cholesterol after I gave birth. And then when I started using PPAR, the migraine episodes, hypogly, and my drastic gaining of weight stopped. As mentioned, I started to lose weight and look more vibrant. So I trust Simply Nature.
Before pregnancy, I'm already taking PPARS. My husband and I, we were really taking, I think during the time, we've been taking it consistently for 5 to 6 months already, PPARS tablets. So, I even think that helped us during the this pregnancy because based on our experience, we had 2 miscarriages before my 3rd pregnancy and my successful pregnancy. And that time, we've been told that, oh, it's not healthy, that's why you're losing the baby. And then we're just, waiting on the Lord and praying for His timing. And during the time when I got pregnant, I also realized that, oh, actually we've been taking PPARS. So, because I've read and heard that PPARS helps with cell repairs, it strengthens your body, it's high in antioxidants and all that. You know, I really think that that contributed for us to have a healthy pregnancy. And yeah, that's what I also took during that time. After I have given birth, I really had difficulty because I had emergency CS. So, but after, on the 3rd day onwards, I was actually feeling better. After giving birth, we're gifted with PPAR, so praise God, and that has helped me a lot because they said that the hormonal changes do not just happen during pregnancy and even after pregnancy. So we started taking PPARs also. And I know mommies who have given birth, I know you can relate to this. If you have experienced constipation before birth, when you have given birth, it becomes like more. It gets to the next level of constipation. So I'm glad I was able to take, and I was introduced to Cleansing Plus of Simply Nature even before pregnancy. So when I experienced all this constipation, when I took Cleansing Plus, it has helped me with my regular bowel movements and to be able to release easier and faster. When I felt constipated, because it's true, even after you have given birth, if you're already constipated, it's like it's gonna go to the next level of constipation. I don't know how it happened, but when I read about it, it's all because of the hormonal changes that happens in our body and our body adjusting and healing. So it's going through a lot. It has helped me because especially if you have given birth, whether that's normal delivery or you had cesarean, you're not really allowed to put pressure when you're about to go. So you're not allowed to push. So the Cleansing Plus really helps, no, for you to be able to release, better and easier. What has helped me in this pregnancy journey and even before that and even after is that I was taking PPARS. My husband and I were taking PPARS tablets. So that has helped me with, of course, the hormonal imbalances. It has helped us to regulate, and it has given us more energy and have healthier bodies. So it has no contraindication, so that would also help you. So you may try on your own and test it for yourself. Hi, I'm Nesta Vicencio, and here's my son, Ethan Kairos. So I had an amazing pregnancy journey and recovery with the help of Simply Nature PPARS. Thank you, Simply Nature. We love you.
Good morning, I'm Mrs. Melinda C. Hispano. Ako po ay na-diagnose ng stage 2B breast cancer and I'm from Muntinlupa City. I'm a public school teacher. Nung nalaman ko po na na-diagnose ako ng breast cancer, syempre may devastated po. And of course, the whole family, parang our world, no, falls apart, no? Sobrang down. There is no symptoms eh. I just felt the lump. Dalawang lump siya sa right breast. And I was not really going for a check-up sa lumps. I was, magpapa-check up ako sa OB-GYN ko. And I was advised to go to the surgeon kaagad. So, after po ng operation, I was asked to go to oncologist. The protocol is to have 8 cycles of chemo and 33 radiation. When I was in the hospital, sa aking bed, browsing through the Facebook, I saw the face of Dr. Jansen. Sabi niya, makakatulong po sa mga chemo patient, yung Simply Nature PPARS. So if you will just try, malaking benefit po sa katulad naming mga cancer patient. I was advised to supplement chemo with PPAR powder saka tablet. So at first I was hesitant kasi very mahal po siya. Pero first chemo ko, taking PPARS, hindi po ako nahirapan. So I was expecting na yung mga nababasa ko, napapanood ko ng mga side effect of chemo. Hindi ko po siya naramdaman. So I was telling my family na parang maganda po yung PPAR sa akin. I finished the whole 8 cycles without any problem. Thanks to my doctor and the Simply PPAR. Kasi po, even my co-teachers, even my family, ang sabi po sa akin, hindi ka mukhang may sakit. So that must be a blessing from up high there, no? That I was able to meet Dr. Jansen and I was able to take Simply Nature PPAR. Latest result of my laboratory, all are normal. Yes, thank you, Lord. Continuous pa rin po yung tablet. So I just ordered 6. 6 ngayong May. So that would last for ilang months. My latest ultrasound, fixed pa din po siya. No calcification or anything. So I thank God for that. Ang papayo ko po sa mga pasyente po na katulad ko, go to the right doctor, no? You pray for the right doctor. Kasi ako pinray ko lang para bigyan kayo ng the right supplements. And para yung journey nyo, yung cancer journey nyo, will be very successful. Kaya nga sabi ko, during my PPAR journey, sabi ko sa sarili ko na I will be the most successful chemo patient in the whole wide world. Thanks, PPAR. I will highly recommend po Simply Nature PPAR kasi based on my own experience, it helps me a lot talaga. And it's a blessing to me na take ko yung PPARS. Kaya nga ang sabi ko, I will be the most successful chemo patient kasi may supplement ako galing sa Simply Nature, which is PPAR powder and PPAR tablet. So, blend together, it helps me a lot. I'd like to thank my daughter, si Cadiz, and also my husband for taking care of me. Hindi siya nagsisisi on that part. Thankful po siya. Kaya nga, nung sabi ko, a-attend kami, and he was very supportive, binatid niya ako dito. I am Melinda C. Spano. I'm a public school teacher. I was diagnosed with stage 2B breast cancer. Upon knowing my situation, it was really a very devastating event. I was advised to do 8 cycles of chemotherapy and natatakot ako dun sa chemotherapy. But with the help of Simply Nature, na-surpass ko, nakatulong po sa akin. It's a big help. Lahat po ng side effects ng chemo, hindi ko po naramdaman. So, I'm very, very thankful to Simply Nature because it really helps me a lot. And ang feeling ko, I'm a very successful chemo patient because of Simply Nature. I trust Simply Nature.
Good evening, everyone. I'm Sheila, and welcome to another episode of Simply Healed webinar. This program is proudly brought to you to the collaborative efforts of Simply Nature International and Simply Healed Medical Group, united by a shared mission to support healing through education and science-guided care. As a trusted wellness brand, we offer high-quality microalgae supplements powered by PPARS to support proactive health. This research-backed formula helps strengthen immune function, optimize metabolic health, and provide vital nutritional support for cancer patients. In the evolving landscape of integrative oncology, modern science is increasingly focusing on the cellular environment to complement conventional breast cancer treatments. By targeting the body's fundamental biological switches, researchers have uncovered new ways to help regulate inflammation, control cell growth, and protect the body during chemotherapy and radiation. At the center of this breakthrough are PPARs, master regulators within our DNA that govern cellular energy, immunity, and survival. Unlocking these pathways provides a smarter, scientifically backed blueprint for cancer care that empowers the body to stay resilient before, during, and after treatment. Let us all watch this.
When treating breast cancer, standard interventions like chemotherapy, radiation, and surgery are essential. They function as high-impact tools designed to confront the disease at its foundation. However, this approach is often indiscriminate. While these treatments target the tumor, they also impact healthy tissues, vital organ functions, and blood cell counts. This systemic strain leaves many patients physically depleted, turning the recovery process into a grueling test of endurance. Because of this, researchers are looking beyond the tumor itself. They are investigating the surrounding cellular microenvironment to understand how the body's own internal conditions influence treatment outcomes. Since conventional therapy impacts the entire body, long-term health depends on more than just eliminating mutated cells. It requires a specific strategy to fortify and protect the healthy tissue left behind. Within our DNA, specific regulatory proteins known as PPARs, or peroxisome proliferator activated receptors, act as internal controllers for cellular health. Specifically, the alpha and gamma pathways oversee how cells grow, divide, and utilize energy. When these pathways are active, they promote anti-proliferation. They signal rapidly dividing abnormal cells to stop multiplying and initiate apoptosis, a process of programmed cell death that prevents further growth. These receptors also address chronic inflammation. By suppressing the inflammatory cytokines that often fuel tumor expansion, active PPARs help stabilize the environment surrounding healthy cells. Finally, they manage energy homeostasis. Since mutated cells require high levels of glucose to survive, PPARs work to regulate nutrient distribution, directing energy away from the disease and back toward the body's healthy tissues. By engaging these specific genetic pathways, the body can systematically limit the biological resources the disease needs to survive, while simultaneously shielding the host. While these regulatory pathways exist within our genetic code, they are often difficult to engage while the body is undergoing the physical stress of intensive medical therapy. This requires the presence of PPAR agonists, natural compounds that bind to these receptors to initiate the protective biological responses described earlier. Simply Nature PPARs provide these agonists through 100% plant-based whole food extracts, concentrated with cell growth factors, RNA, and DNA. These extracts are designed to work alongside conventional treatments. By supporting tissue repair and protecting healthy cells, they help the body manage the side effects associated with chemotherapy and radiation. These compounds also assist immune surveillance. They stimulate natural killer cells and dendritic cells, which helps the body identify and address rogue cells more effectively. This support extends to total cellular balance. By regulating blood lipids and fueling cellular energy, the extracts help the body maintain its internal stability even under significant physical pressure. This isn't a replacement for standard medical care. Instead, it strengthens the host, allowing medical treatments to proceed while minimizing the debilitating impact on the rest of the body. The evolution of oncology highlights a shift in focus. The most effective care involves both confronting the disease and actively supporting the patient's biological resilience. By utilizing PPAR pathways, patients have a tool to help maintain their quality of life, strength, and vitality throughout the entire duration of their treatment. Healing is a collaborative process. By partnering with your body's genetic resources, you remain supported from the first day of treatment through recovery.
Today's webinar is all about you. We're dedicating this session to answering your questions and giving you the tools you need to succeed on your journey. Without further ado, let's get started. Joining us tonight to lead this AMA or Ask Me Anything portion is a highly respected health expert. It's an honor to present our Singapore-based PPARS expert. As a visionary CEO behind Simply Nature International, he combines his entrepreneurial success with years of international speaking experience to share deep insights on how health serves as a foundation for true success. Let's all welcome Mr. Shyan Lim. Good evening, Sir Shyan.
Good evening, Sheila, and good evening to all our viewers. I hope today we'll get to answer your important questions and that you'll leave tonight clearer and more confident in your journey towards your health.
That's right. All right. Shall we start with the first question, Sir Shyan?
Yeah, let's go.
All right. Okay. So for the first question, how to take for breast cancer, but I don't have a stage yet. Can PPARs be sufficient, and how many should I take?
Okay. There are many. Let me give you the quick answer first. So if it's for cancer, the best product that we have is the Simply Nature liquid PPARS. All right. Next will be the powder extract. So which one will you take first? I would recommend taking the liquid extract for 1 month, and then after that, go for a scan, do a diagnostic, because you need to check whether the lumps grew bigger, if it grew smaller, if it stayed the same size, so that you can decide what to do next, okay? So that's the straight answer. Now, the details is this. You haven't done your staging. So my first question is it confirmed that it's a malignant? That means the tumor could be benign. That means it could be a growth, but not a cancer. Okay, so if that's the case, then you might not need to take Simply Nature PPAR liquid, right? Because it's benign, which means it's not cancerous, your life is not in danger, you can go for the Simply Nature PPAR extract powder. Okay, the powder is less powerful than the liquid, but it's also financially more palatable. Okay, so financially it's easier, it's not as mahal. Okay, but because for cancer, we will always recommend the best product that we have. We won't think about the budget, right? Now, if there are any budget issues, always talk to our CSOs, Sheila, Daisy, and Jhen. They'll be able to advise you how to get the best out of your budget, right? So the liquid extract is definitely the first thing to go. Take it 1 vial once a day, all right, for a month, all right, and then go for another scan. Now, you got to give us a bit more information about why is the staging not done? How many lumps do you have in your breast, right? Are the lumps big, small? What was your initial scan? So this advice that this is not a consult, so I'm just giving you in general, based on a general condition that you have mentioned, what we would do. Okay, so also remember, anyone among our viewers who take any of our extracts, please remember to take the tablets as well. Meron, let me help you explain. The extracts are, Meron, car key, all right? It will switch on the engine. It will switch on your engine. So your body's systems will be switched on to start fighting the cancer. Now, the tablets are to help you, Meron. It is the motor oil, it is the gasoline, it is the lubricant to help your car move smoothly, right? So once you switch on your PPAR receptors in your body, all your metabolic pathways, your immune response pathways, your anti-inflammatory pathways, all will be switched on. But Meron, they still need nutrients to function to their maximum, okay? So that's why we always match the tablets with the extract powder. So some of you might say, Sir Shyan, do I really need the tablet? Yeah, I would say so, because normally when we deal with a cancer patient, your appetite is usually affected, right? And the reason why you have cancer is probably, it's a very good bet, almost 95% of the cases, you are not eating right. Okay, that means your diet every day is not the healthy diet. It may not be unhealthy. It's not like you're eating fried chicken every day for breakfast, lunch, dinner. Okay, it's not like you don't eat vegetables. You eat, but not a lot. But it may not be an unhealthy diet, but it is definitely not. Most of us do not have healthy diets. Okay, we may have okay diets, but once you are fighting cancer, an okay diet is not enough to give you victory. all right? You need a healthy diet, and which is why the PPAR tablets is to supplement, is to make sure that whatever diet you're on, if you're on okay diet, it will help to make sure you have the basic nutrients to help you fight cancer. Okay, so that's why you always need the tablet. Sayang, imagine I give you the car key to your new Ferrari, but walang petrol. You can't even drive it out the. You switch on the engine, go. And then you can't move the car. You have to go and push the car out of the showroom. So this is what happens, right? So that's why we don't want our clients and our patients to feel sayang. You take the PPAR extract, it's so powerful, your body is activated, but you switch on the engine is not moving because walang petrol. Okay, so this is a simple combination, and cleansing will be very important as well. Okay, if you are not regular, what is regular? Going twice a day, going to the CR and poo-poo twice a day. That is regular. Okay. Now, if you're not regular, I would suggest that you take cleansing. If you're not so sure, if you think you are okay, then maybe just get our packet of 5 sachets or 3 sachet packets. We have those smaller, it's not sample, but smaller packages. Why? I think when you start on a program to get your health right, the first part you need to do is detox. So of course, the PPAR tablets is very high in chlorophyll. It will help you detox, but you still need to clean. You really need to scrub, all right? So that is what the fiber is for. Most of us in Philippines do not eat a high fiber diet. No, we don't. Meron processed food. Even for me, I'm healthy. I don't have cancer. I take Cleansing Plus every Sunday night. Every Sunday night, because on Monday is my meeting day. I have online Zoom meeting with Sheila and everybody. I don't go out in the morning on Monday. I stay in my office. So because of that, I will do the Cleansing Plus on Sunday night. Then Monday morning, I will go to the CR. Okay, so that's what my weekly cleanse. Now, that's also important for cancer patients, all right? You need to make sure you're regular. For your information, if you are not regular, it affects your immune system. I think many viewers will be surprised by that. Okay, going to the CR will affect my immune system? Yes, it affects your immune system a lot. Just to help you understand why, your immune system is carried in your blood system. So your blood is a large part of your immune system. Okay, your blood is produced in the bone marrow. Okay, so your immune system is born in your bone marrow. Bone marrow is the hospital where you give birth to your immune system. But the primary school, the grade school and the high school is actually your gut, your GI. So your immune system is developed in your GI, which is why if you are constipated, you're not regular, your GI is not functioning properly. Your gastric intestinal system is not functioning properly, even though your immune system is not strong. Okay, so you can understand why the Filipino diet of eating mang inasal and all this all the time. All right. First of all, you become irregular, diba? No vegetable. You take a lot of soft drinks and things like that. And then many Filipino I know meron heartburn, diba? So you know your GI is no good. Then that's why meron cancer. Your immune system is weakened also. So I hope this helps us understand it's important to have healthy GI. So that's why we take Cleansing Plus to clean out your system, right, of all the dirty poo-poo stuck inside. This helps with how you feel. You also feel better, okay? And then it helps with your immune system. So I hope I answer your question. Simply Nature Liquid Extract for 1 month, all right, together with the tablets. Now talk to our CSOs if this plan is the best for you, all right? If for example, financially cannot do liquid extract, then do at least the powder. Okay. Now, if you take the powder extract, take 2 or 3 scoops 3 times a day. Breakfast, lunch, dinner. At least 1 hour before food. Okay, 1 hour before food. All right. So let's say, what if you forget? Sometimes we may forget during lunch because meron busy, right? If you forget, then take it 1 hour after food. All right. Okay. So 1 hour before or after food. Don't take it together with food. Never take our extracts together with coffee, just in case anybody will ask this question tonight, okay? Never take any medication together with coffee. Never take any supplements together with coffee because it will destroy the benefit of the supplement. This includes tea, okay? This includes tea, okay? So you don't take tea or coffee and you don't take your soft drinks together with your supplements for so long, okay? As long as anything contains caffeine, no. Take plain water. If you really need to, then maybe natural juice if you really have to, but water is the best.
Thank you, Sir Shyan. I love that how you explained how important the cleansing plus is, and it's actually the very reason why it is always included in the options that we give to our cancer patients. Very
Yes.
nice. All right. So for our next question, this is thrown to us through our YouTube channel, because we are also simultaneously playing there. So coming from Miss Battling, BSTRD. Okay. Question is, if I take the liquid on non-chemo days, can I take the tablets on chemo days?
Yes, of course. Take the tablets on the chemo days. Okay. Number one, when you go for a chemo, usually it affects your appetite. So that day you probably it could be bad enough that you don't feel like eating much. Then all the more take more tablets. There no limit on the tablet. My personal limit is about 150 tablets in one day. So you may be thinking, Sashan, why are you taking so many? Okay, I'm not sick. Okay. The tablets Meron is really plant-based whole food. So the reason why I take 150 tablet because it's my meal replacement for that day. I do this when I was doing full day training courses when I'm the head trainer. So I don't have time to eat, and if I eat, I get sleepy. So I only take the tablets. And because of that, I cannot just take 10 micro tablets, diba? If it's a meal, the volume is also important lang. Imagine how powerful, how many calories can you put in like 10 micro tablets? Okay. So because it's a total meal replacement, not just a nutrient. I took 150. The record, it belongs to my dog, whose name is Prosper. His record is he took 600 tablets in one shot. Grabe. And he's only 14 kilograms. I am 69 kilograms, right? So I 69 kilograms, I eat 150. He's 14 kilograms. He took 600. Okay, Meron, my tablets don't come in the same bottles as the ones that you buy from Simply Nature. My one comes straight from the factory, so it's a big silver foil. Okay, 1,200 tablets at a time. So my dog Prosper actually jumped onto the kitchen table, and he really likes the tablets, right? And yeah, he took 600. Anything happened to him? Nope. Just very healthy, that's all right. Did he go like Meron caffeine running around like super dog? No. You don't become hyperactive because you take too much Simply Nature PPAR tablets. It doesn't work that way. Okay, but his poo-poo was green color that day. Okay, that's because the chlorophyll he had more than enough chlorophyll, it doesn't react. So those of you who take chlorophyll supplements, if your poo-poo is green in color, there's two reasons. One, your body is not absorbing the chlorophyll. Number two, your body is clean. Because if you have toxins and you take chlorophyll, your poo-poo will be actually dark in color. Meron the chlorophyll and the toxin will meron chemical reaction, so it would change color. So if it comes out green, that means the chlorophyll did not react with any toxin. So either you're very clean or your body didn't absorb the chlorophyll. That's why your poo-poo is green color, okay? So just a little bit of tidbit for you. So yeah, you can eat the tablets on the day that you're going for chemotherapy. No problem at all. In fact, it's a good thing because it's probably the thing that will help you stay strong throughout. The PPAR content and everything, the antioxidant content and all that will not affect your chemotherapy at all, right? Because if you can eat orange on the day of your chemotherapy, or watermelon, or for example, guava, which is rich in vitamin C, which is an antioxidant, if you can eat all these fruits, you have no problem taking like 20 or 30 or 50 micro tablets. It's smaller than a guava, okay? So this is for you to understand. But yet it's going to be very powerful because it contains a lot of nutrients, the omega-3, omega-6s, and of course, it does still contain PPAR agonists to activate your systems, okay? Yeah.
Perfect. Thank you. Thank you, Sir Shyan. I just want to greet Miss Melinda. She's also watching in our YouTube channel. Perfect. Thank you, sir. Now, the next question, quite interesting once again, coming from Mr. Romel Cadangyao. Question is, are there any known side effects of taking this immunity supplement?
No, there isn't, all right? But there are many side benefits. One of the benefits is anti-aging and longevity. Okay, you may ask me, Seshen, how can you be so certain that there are no side effects? Okay, because we did an LD50 test.
Yes, there.
I don't know of many new supplements that do LD50 tests, because LD50 test is usually done for drugs. Okay, what is LD50 test? LD50 test is lethal dosage 50%. They need to do this for Meron drugs. Okay, what do? They keep increasing the dosage of the drug until half the number of the test rats or mice dies. They want to know at what dosage will kill half of the test subjects. Okay, so they will buy special laboratory mouse. Of course, you can't do lethal dosage tests on human beings because you cannot let anyone die, diba? Okay, so they do it on mouse. Okay, so for example, let's use orange juice lang, so easy to understand. Let's say they feed the mouse 50 ml of orange, 10 mouse. They feed 50 ml orange juice. Nothing happened. They feed 1 liter of orange juice to every mouse. Then out of the 10 mouse, 5 died. Okay, so now they know the lethal LD50 is 1 liter. If you take 1 liter of orange juice and you feed it to a mouse, half of them will die. Okay, so this is an LD50 test. Now you can understand why this is important for drugs, diba? Because they want to know at what dosage the drug will kill half of the patients. Right? So you don't need to even reach there, but they want to also know you have a 50% chance of dying if you take so much. So imagine, right, if you take paracetamol, you can take 40. I think you can take up to 200 paracetamol and you're still okay. How do they know that you can take 200? Because they have tested it on, of course, not on human beings, but on mouse to know how much a person can accidentally take before they die. And this is important because the doctors need to know what is the dosage. Paracetamol is, of course, a very safe drug, right? Something that we are comfortable, that we can even eat 20 and nothing will happen to you. But there are other drugs like very strong antibiotics that could damage your liver and cause you to have very long-term serious side effects or maybe even kill you. There are other drugs, steroids and all that. They need to know the actual dosage. So they do this thing called an LD50 test, lethal dosage 50. Okay. Simply Nature actually tested our products on LD50. So I can guarantee you not many. I can't even think of any actually. I only know drugs do this. Now we do this because we do testings for cancer patients. And then we do cooperation with hospitals, with oncos, testing on cancer patients. So in order for hospitals to want to do clinical trials, that means testing on human being, they need to make sure this supplement won't kill anyone. That's why we have to do the LD50 test. Now, when we did the LD50 test, it turned out to be negative. That means no matter how much you eat, no mouse died. So the conclusion is walang long-term toxicity built up. That means no matter how much you eat, for how long you eat, it doesn't build up in your body. Your body removes it, right? We tested up to 50 times what a human being, our dosage will be recommended. 50 times. And still nothing happened, all right? So that goes to show how natural. Not only natural, not everything natural is safe, actually. You can take a natural mushroom from your garden and it could be poisonous. So just because something is natural does not mean it is safe, right? Not every mushroom you find in the forest you can eat. Some are poisonous, okay? But what the LD50 test show is that not only are we natural, we are actually very safe, okay? So no contraindications. The product has been around for more than 50 years. So not only have we done the LD50 test, we have patients taking all sorts of different medications. And so far, there are no contraindications. So in your condition, which is something that is already very experienced, so for example, cancer patients, patients with metabolic syndromes, so on and so forth, we have even lupus patients, right, taking our product. And yeah, and if you look at the mechanisms of action, when we talk about the science, yeah, there really isn't anything that is contraindicative. Okay.
That's right. I just want to answer, because I think this question, I think quite right, because some of our patients were asking us after taking the PPARs, they feel quite feverish, or
Oh,
remember we have
okay.
this eczema patient who actually it seems
Okay.
like
Okay.
yes.
So let me talk about this one. All right. Very fast, two things. If because you're in Philippines, this is a question. If you are in Singapore, maybe Malaysia, if you're Chinese background, you probably won't ask this question so much. Okay, here's the reason why. In Philippines, for most Filipinos, when you take a drug, right, you expect to feel better. Yeah?
It's true.
Diba? You take Imodium, your LBM disappear, right? Diba? You don't go to the CR anymore. You take a medication, you don't feel like vomiting anymore, right? So the standard for drugs is this: if you take the drug, you will feel better. Okay? So if you take something and you don't feel better, that means something is wrong. Right? This is why you are asking me this question. So Shyan, how come I take the PPARS, I feel a little bit feverish? Okay. Now, this is different from the rest of Asia, especially China, Singapore, even Thailand and Malaysia as well, where they use a lot of TCM, traditional Chinese medicine. Okay. Why? For this, if your body doesn't have a reaction, then the medication is not working. It's a different thing, right? So for Western medication is to make you feel better. For Eastern medication, you're supposed to feel something, right? There is always, usually, you feel worse before you feel better. Okay, Sheila, just to ask you, okay, if Dominic ran outside, fell down the stairs, and sprained his ankle, okay, what would you do? What is the standard treatment for sprained ankle?
Usually we do either cold compress or
Cold
spring.
compress, right?
Yeah.
Cold compress, right?
That's right.
The Chinese actually take the ankle and start rubbing the ankle and moving it around. Okay. So it's why? Because the you will notice when you sprain an ankle, swollen, diba?
That's right. Yeah.
Swollen. Okay. So for the Western medicine, they want to cold compress, right? To relieve the pain. All right. Constrict the blood vessels, make it shrink because it's cold, and hopefully manage the swelling, the inflammation. Okay. The Chinese approach is the reverse. They want to make sure that marrow circulation. All right. So they rub, and they also push the joint back into position. So this is painful. It's painful. Okay. So they rub first before they put then they put medication and then bandage the ankle as well. But the first thing they want to do is make sure no stagnation, because the idea is that when you sprain your ankle, the blood vessels there may have been hurt as well. Then they don't want the bad blood to get stuck. Okay, so they rub to make sure any circulation there that has been stuck is unstuck. Because if marrow stagnation, marrow like your drain, outside your house, the drainage, if your water is not flowing, what will happen? Marrow smelly, mosquito, and start to have bad things, right? So, but a river that flows is clean. Okay, so this is a simple concept when it comes to the ankle, why they rub the ankle instead of cold compress. Okay, so it's different. Does it work? Of course it works. But there's a skill to it. So we don't just rub it ourselves. We go to a twinner. Okay, someone is literally called manipulation. There is an expert, there's a way you massage to promote circulation, right? And then after that, the healing will be faster. So you see, okay, so this is the reason why in Philippines, if you feel feverish, you'll be wondering, is the product working? Why am I feeling feverish? Because you've been trained by Western approach that if you take something, it should make you feel more comfortable. Okay. Now I will ask you, your tummy upset, food poisoning, for example, very painful, or don't feel comfortable. You don't feel comfortable, right? You feel something's wrong. Then when you vomit, the whole point of vomiting, is it comfortable? Is vomiting comfortable? No. Sometimes it's even painful, right? Your whole face is red because the whole face is red. You can feel the blood rush to your eyeball if you are vomiting very hard. Yeah, and it's very uncomfortable. Sometimes you vomit until it's very painful. You vomit until your stomach is very painful, right? And you vomit so hard that, yeah, the black color thing comes out. At first, it's just the food. Then later, then the black color thing come out. And then when do you stop vomiting? When there's nothing left to vomit and what is coming out is just the acid, right? But before the acid, there is like smelly stuff really come out. That's the food poisoning, actually. Now, what happens after you vomit everything out? You feel
comfortable.
You feel comfortable. Okay, so this, you notice, this is natural. Your body's natural way of treating it. You will feel uncomfortable first before you feel comfortable. But if you have food poisoning, you go to the doctor, he give you an injection, straight away you feel comfortable.
Thank you.
Okay?
Very encouraging. I mean, for those who are experiencing just minor reactions, no, it's actually the very reason that all the more you have to continue on with PPARS. But of course, for major ones, we encourage you to coordinate with your doctor still.
Okay, so here, let's use this vomiting, food poisoning thing to help us understand, right? When do you know that your vomiting is grabe or too much? When blood comes out.
Yeah.
Right? But if it's just vomit and a bit of pain and you feel uncomfortable and your eyeball want to pop out because so much effort, okay, still okay, right? But what if you vomit until you're seeing white light and you're about to faint, and then you notice blood come out? This is not the healing process anymore. All right, it's not the healing process anymore. So the same way when you take Simply Nature PPARS or any natural approaches to healing, there is a certain amount of reaction that is natural.
Yes.
But you should know when it's not natural. Okay, now slight feverish is why. Because your body is actually reacting, right? So if your immune system is stimulated, your immune system is going to start to work. When your immune system works, chemical warfare, okay? So how does your immune system work? Is biological chemical warfare. When we talk about biological warfare, I mean how your cells fight the cancer cells is actually chemical warfare. It's actually chemical reactions. Okay, different enzymes, different minerals and amino acids, proteins. They're all reacting. So it's chemical process rather than mechanical. All right. So because of that, don't you realize? Why do you get fever? You get fever because marrow virus go in your body. Your immune system is attacking the virus, and there's inflammation. That's why you feel the heat. Okay, so that's what fever. So if the virus is very aggressive, then it creates more and more places that your body is fighting. Then it creates higher and higher temperature, and then this is dangerous because the temperature actually affect your other organs. For example, if your temperature go above 40 degrees, it starts to affect your brain. All right. So this is that's why it's not good. But if you feel slightly feverish after taking PPARS, it's because your immune system is being activated and it's actually working. And because it's working, you're gonna feel a bit of a buzz, right? You're gonna feel a bit of a heat. Now, how do you know when this is no longer normal? It should not persist more than 1 or 2 days, maximum 3-4 days. And it should not be acute. What's acute? It should not be extreme. You shouldn't have 39 degrees, 39.5 degrees fever. Okay, if you are slightly feverish, okay. You feel warm, okay, right? But if you suddenly have high fever, then that is not. It's probably not the PPARS. You might have really caught fever. Okay. So I hope that helps you. I hope that helps you gauge. Okay, it's not so difficult, guys. It's really not so difficult. If it's if you don't see blood, okay, if you don't see blood, you don't faint and things like that, okay. If you don't feel sharp pain, okay, if you don't feel sharp pain, all right, then if you feel the most common one is feverish.
Yeah.
The other one is the area that the pain that you're trying to stop actually get a little bit stronger than usual. Okay. For example, you're taking PPARS because you want to help with your migraine. You might have a slight another migraine attack. Okay. Okay, but then you will observe the way you recover from this attack will be different from the last time. Okay, and then the next bout of migraine will be less and less and less. So this is what they call the Herxheimer reaction, or what natural healing will call healing crisis, right? You got the body is kick-starting and so it reacts. Okay. Now there are a few ways to reduce this. One is to increase your dosage slowly. But then again, you don't get the strong healing effect. Okay. The other one is to just persist. Okay. Now, if you're alarmed, or if you're the type of person who very scared, want to take it slow, whenever you feel this, then you lower the dosage. Then the healing reaction become less, right? So you feel it less. But the downside, there is a negative to it. That also means that the positive effect of the product, you are going to slow it down. So if you wanted to see, for example, your tumor shrink, instead of shrinking, it will stop growing. Why? Because you lower the dosage. So it cannot shrink the tumor, it can only stop the tumor from growing. But again, sometimes it's better than you so scared and then having a nervous breakdown, Deepak. So if you continue taking the product, your tumor will start to shrink. All right. And usually after 1 week of taking any natural product, not only PPARS, your body gets moving already. So you won't have all these side effects. Okay. So yeah, it should not persist usually not more than 2-3 days, and at max 4-5 days. It shouldn't cross a week. Okay. If it cross 4-5 days and it gets worse, now it's not a healing crisis already. There might be some other things. It's most probably not the product. Not only PPARS, but any healing product they are taking, right? It's most probably not the product. It's probably another development in your illness or another illness. Okay. Okay.
Thank you. Very encouraging. I mean, all this coming from our PPARS expert. This PPARS question also. I hope everybody is encouraged to continue on with your dosing that you're taking right now. Okay. For our next question, coming from Mr. Vana Arevalo, question is, how many tablets per day if it's just for disease prevention? Wow, preventing.
Oh,
very good.
Okay. I would say it really depends. Okay. If you're a very healthy person, then probably 10 or 15. Right? If you are not so healthy, 10 it will have a good effect. Okay, so it sounds so funny, right? How come the healthier you are, the more you need to eat? Yeah, because you're already very healthy. Imagine you are already top runner in your school and you want to run faster. It's harder to improve. The better you are, the harder it is to improve, okay? But if you have a history that you're not a very strong person, you always fall ill very often, then I will tell you, even 10 micro tablets a day will make a difference to you. But if you are a marathon runner and already so fit, you want to take PPARS and feel the difference, then you got to probably take 15 or 20 in order to feel the difference. Why? Because you're not aiming. Okay, for a person who's very healthy, you have to score 90 in order to feel the difference. But if you are a student that always fail the exam, just passing the exam, hallelujah, you already feel the difference. Okay, so for maintenance, I would say 10. Okay, I would say 10 in general, 10 to 15. All right. For therapeutic, 15 and above. Usually I would start at 20, go all the way up to 30. For those with eczema, they take 40 to 60 tablets a day. Okay. Now, are there times where I will suddenly take 30, 40? Yes. Give you an example. Let's say tonight I work very late. Okay. And tomorrow morning I wake up, I only slept 3 hours. I went outside, got caught in the rain, come back, I noticed I have a slight headache and I feel already feverish. Meron, I know I'm tired. My immune system is weak because I didn't get enough sleep and I was caught in the rain. Then I will probably take at least 20 to, it's like a flu is coming, you take extra vitamin C. Okay, so you can use PPARS this way, and it's more than vitamin C. It will trigger your immune system to be more active. It will give you the nutrients all across the spectrum. It will strengthen you in many ways, right? So it's better than taking vitamin C effervescence. Definitely better. If you are just talking about fatigue and you don't know what is coming down, you just feel a bit weak. Yeah, you can do that, and you can do that for prolonged periods of time. So, for example, I just talked to my friend, now that she is 50 years old, she said when she go overseas to recover from a trip, it takes her a longer time. When you're young, you go for a trip, you come back, then tomorrow you go back to work,
You're
diba?
okay.
Yeah, but now if you go for overseas trip, even if it's for vacation, you come back, you feel tired because of
Ouch, yeah.
the time zone difference, the long flight, the
Jet
travel.
lag, yeah.
Okay, so if you're under that condition, feel free for entire week or 2 3 days. You're actually taking 30 40 micro tablets. You're just refueling your body quickly. Okay, yeah.
Perfect. I love the idea of that because normally when we are asked about preventive protocol or dosing, we just say 10. But you are correct to say that for those people who are in need of such more energy, of course they would need more PPAR dosing as well. You're
I'll
talking
give you
about
a, I'll give you an
longevity.
example. Yeah, for Dominic, right? What if you found out Dominic comes home tomorrow and say, "Mommy, there is a few people in my class that got hand mouth foot disease,
FMD, yeah, foot and mouth disease.
foot and
FMD.
mouth disease, right?"
Yes.
Then what would you do?
I would double the dosing,
Yeah, you see,
definitely.
you know what I mean? Okay,
That's
so
right.
guys, this is how you can use PPARs, right? So that's why it's wonderful. We did an LD50 test, so you don't worry. There's no side effect and no build up. You just build up benefits. You don't build up anything negative. So anytime you hear or his classmates have measles or something, or there's a fever going around, just ask them to take more. All right, and there's no upper limit lah.
And I think what's amazing with what I've heard from you, Sir Sean, is that
Mm.
the fact that it's quite possible for people who are aiming for longevity,
Yes.
that they are not sick at all, but they aim to get more, to get out of their bodies, to not exhausted, but to live their life fully,
No,
So
it's really important, especially I've been speaking to a few longevity experts and all of us, and doctors as well, and researchers as well. All of us agree something. Sheila, after COVID-19, everything changed. Those of my friends, like myself, who have crossed 50 years old, we notice when we wake up in the morning, I don't know for someone your age, okay, when we wake up in the morning, our muscles feel tight. I mean, we really feel tight. And when we think about it before COVID, and it's not because 6 years has passed, okay? It's not because we are older, all right? I mean, that is a factor, but not the same way, right? Because it's across the board, right? So even the 60-year-olds that are already older than us, they feel worse, right? And it's not because they grew older. There is a shift. They notice this. We are complaining about it today, which is about 6 years since COVID, right? But actually, we noticed the change as early as 2023, right? It's just that it's been, and we thought it will get better, but no, it didn't get better. Our muscles remain tight. No matter how I stretch, the muscles tighten faster. So if I do stretching for 2 weeks, everything becomes better. But if I stop, the tightness comes back fast, right? Which means something has changed in us. It could be due to it is definitely due to the COVID. It could also be made worse by some vaccines, right? So there are already a lot of lawsuits across the world. They are suing the vaccine companies because there is a proven case that there will be cardio issues, heart issues related to COVID vaccines, there are mRNA vaccines. Okay, now not everybody will get them, but yeah, it's already a strong case that they want to do. There are class action suits already out. A class action suit is not a one person suing. It's not suing for a specific case of the vaccine. It's suing for a class, which means it's a whole category. Everybody within this category have all the same side effects. So it's a suing. So it's a big thing now, right? So to do this only makes us in the future, if you want to live healthy, you got to be even more proactive. So taking the right supplements is important. So some key supplements that we all have to take is like vitamin D, vitamin C. Okay, but these are the standard ones that you can find. But these are not as helpful for many people. What will be more helpful for many people is like PPAR tablets. Why? Because we help manage inflammation. Okay, but inflammation is not only managed Meron antioxidant oxidant. It's not like the plus minus only. Okay, you got to fix your thermostat. All right, so you got to fix the controller for inflammatory response, and that is actually in our PPAR gamma. It will fix or modulate your inflammation in your body. Okay, so this is a more specific kind of supplement to help with your longevity. Okay, reduce inflammation, not reduce it because of antioxidant. Okay, because when we talk about antioxidant, we talk about plus minus. Okay, you have oxidative stress, so you have antioxidants to reduce, to fight plus minus, Meron neutralize, diba? Acid alkaline like that. No, there's more than that, right? It's triggering the pathways to manage the inflammation. So it's very different. Okay, it's not the same mechanism. Next is mitochondria function. So you'll notice after COVID-19, many people feel more tired easily. It's not that if you rest, you don't get recharged. You get recharged, but then you get tired more easily than before. Okay, so preserving your mitochondria is part of longevity also. So mitochondria is basically your battery for every cell. All right, so PPAR actually preserves the battery. So it's like your EV Meron, your Meron EV, your BYD, diba? If your battery lasts, then your BYD can last longer. So it helps with that. Okay, yeah.
Excellent. Thank you, Sir Shyan. Well, I think will be our last question for tonight. Okay, coming from Miss Linda Magbalon. Question is, I will have my radiation soon. What's the recommended dosage per day?
Okay, for radiation, right? Okay, number one, I would still recommend, okay, if you can take PPARS liquid, all right, before, after your radiation, that would be the best lung, okay? To give you a good example from a movie, and I know it's it's not a very scientific example, but it's very powerful example. If you watch Iron Man 2, Meron Tony Stark, because of his Iron Man suit, was getting radiation. He was always drinking a water bottle, green color liquid, right? Because he was drinking liquid algae, because algae are radiation scrubbers. It will take the radiation out of your system. All right. So that's why I would say at least the tablets, if finance is not an issue, the liquid will be best, right?
Yes.
Okay. The dosage, just one will be one a day will be fine. Okay. And if you want to save money, you take the day one the day before, one on the day, and one the next day. Then save. Then don't eat the rest of the thing and wait for your next radiation treatment. Okay. Worst case scenario, if you are really on super budget, not say super budget, you really want to stretch your budget. If you get a box of liquid, right? You take the liquid the day after. Okay, so you go for radiation, you take it, right? Then you take lots of PPAR tablets, like 30 to 40, right? Okay, per day on your normal days. Then you save, because Meron one box have 10 liquid vial, diba? So you can count how many radiation sessions you have lung. So you take one after every radiation session. Now, if you have only 5 radiation sessions, then you can choose to take one before, one after, or 2 consecutive days after, to help you recover quickly. okay,
That's right.
to help and protect the rest of your healthy cells, all right, help them recover quickly. So that's one way to do it. If you're taking tablets to support yourself through those radiation therapy, then yeah, at least 40 tablets. Now, if you're going for radiation therapy, it means that you have cancer, right? And that you're using radiation therapy to kill the cancer cells. So on that note, I would say go for the extracts, okay? So taking liquid every day is actually going to help you fight the cancer itself, okay? The liquid will strengthen your body and actually trigger your body to fight cancer. So people who choose to fight cancer totally naturally, the liquid is a very important strategy, right? It's the foundation protocol. It's not the only thing you do, but it's one of the most important and the most critical thing that you need to do, right? You do that and then you add other protocols to it. Now, you can do a combination, right? You can, let's say, buy liquid and powder jar. Okay, why? This will stretch out. This is for most efficient budget lang. Okay, this is the most effective for the money. Okay, the liquid is for the day after your radiation. Okay, the day after your.
Yeah, you know what? For some protocols, the radiation actually lasts for 28 days, and for some days, they have to do the radiation alongside chemotherapy
Wow,
for
so it's
certain
very
days.
tough.
It is. It
Okay,
is.
Sheila knows this because Dominic went through, her son went
Same.
through radiation and chemotherapy. Okay, then you have to take continuously lang to help you and endure to go through it properly. Because what you want to do is preserve your immune system lang. Okay. Is there a danger? So I had a conversation with a naturopathic, sorry, an integrative doctor, right? Which means she's actually an MD, okay? She's a medical doctor, but she's practicing integrative medicine. Okay. So I said to her, what would I said, Doc, would you still use a protocol if it reduced the effect of the chemotherapy? Right? She said, yes. I said, why? Right? So we discussed and we came to an agreement, right? If you don't help the patient survive the chemotherapy well, that means protect the rest of the body, right? And the patient cannot take it. That means she cannot continue the chemotherapy. Then the treatment stops, right? So she's supposed to go for 8 sessions to fight her cancer successfully. After the 4th session, she cannot take it already. Literally cannot take it, as in if she takes it, she might die, right? This is because, that's why chemotherapy is only administered, for those of you who don't know, it's always administered in a hospital. Why? And then you'll be observed, right? If you do intravenous, okay? Yeah. Why? Because they need the ER to be near. In case the patient has an adverse reaction to the chemotherapy, the ER, emergency room, is just beside the clinic. Okay, this is the reason why. So, so we came to agreement. Yeah, even if it reduces, right, it's better that the patient is able to go through 8 cycles, even though the effectiveness of the chemotherapy is not maximum, right? But the patient can go through 8 cycles. So the treatment will be complete. Now, I'm sure all of you have heard, and some of you have actually experienced, the doctor say we're going to go for 8 cycles. Then after 8 cycles, your tumor from 5 centimeter become 1 centimeter. Maron still got tumor, right? What will your doctor do? What will your doctor do, Sheila?
They would extend, definitely.
They will increase, right? That means you go for another 3 more sessions.
Yes.
So the most important, that means they can always give you more session to complete your journey. But if you cannot survive, you stop at number 4 instead of 8, then your journey ends. Okay, so this is why we understand. In fact, there are there are drugs to manage chemotherapy side effects. There's one, I forgot the name. But it actually also reduces the chemotherapy's effectiveness. But yet, it is still prescribed. Why? Because it's better that the patient is able to survive the chemo and then can add a few more sessions if needed, right? Than not being able to complete the chemotherapy sessions. So yeah, right?
I just want to share, sir, no, on the positive note, because your example is with the factor of increasing or extending the chemotherapy. But for some patients, some of our patients, before they actually finish their chemotherapy sessions, like for example, the 8, before uh on the 6th session or 4th session, the tumor is actually
Yeah,
no more tumor already, no more
yeah.
residual at all. But you know what? They are their doctors are suggesting them to continue on. They need to finish the protocol. They still need to.
Okay,
It's very possible also.
yeah, your case and the other case. I also have cases where the clients and the patients, the doctor actually reduced their number of sessions.
Oh wow.
Okay. Okay, the reason is because the last few years, for the viewers who are watching, the last few years, there's been a change. There has been a movement among the oncologists, and this is coming from the American Society of Oncologists. Okay, so it's not the PMA, it's not the Philippine Medical Association, it's the American AMA, right? They are now pushing for less drugs. Okay, just like last time, do you remember 40 years ago, every doctor, gynae will tell you formula lang. Di ba? Di ba? Did you grow up on formula when you were young?
I guess
Or
I
was it
am. I
expensive?
believe I am.
Yeah, in my time, everybody
I
thought that
was.
formula is better than breast milk.
Breast milk, yeah.
But today is different, huh? Today is different.
They are
Today,
promoting breast milk.
breast milk, to the point that Singapore's, I just came from 3 weeks ago, I was at Singapore's #1 OB-GYN hospital. This KK hospital is our specialized children's hospital, and it's also the place where they have the best OB-GYNs, all right, gynecologists. Okay. It is a strictly breast milk breastfeeding hospital. They have formula only for emergency cases. That means the formula is special lung. It's for kids who are born like jaundice and things like that. Okay. They even have a breast milk bank. Okay. Same here in Philippines. So this is what I'm saying. 40 years ago, everybody is formula. Today, the doctor will tell you, right? Better breast milk than formula. So there is a movement the last few years. It's been starting maybe about 5 years already. More and more oncologists are trying their best to give less and less chemotherapy.
Very good news. That's very good news.
So maybe that's the reason why I've actually heard of patients and clients of Simply Nature where the doctor said, "Oh, you're good. We don't have to do 8 sessions. We can stop at number 6. We can stop at number 6, right?" So these are the points. These are the thoughts that you can have, right? So what do you want to do? What you want to do is like strengthen and help your body throughout the whole process. Ideally, that okay, and Simply Nature PPARS is actually a sensitizer for some chemotherapy. That means it makes the chemotherapy work better.
Yes.
Okay. I don't know. We should make a list, Sheila. We should make a list. Yeah, let's do
Together
a list.
with Dr. Jansen, yes.
Yeah, and then we make a list which is the sensitizing chemotherapy agents, right? Okay. So for the question who asked about radiation therapy, now you're going for radiation therapy. I assume, if I'm wrong, please let me know. I assume it's for cancer treatment. So there are 2 reasons why you're taking the product. One is to help you recover from radiation therapy. Number 2 is to switch on your body and let your body fight cancer. So it's actually a natural protocol. It's a natural immunotherapy. The way our product works is basically how the synthetic drugs in immunotherapy work. Immunotherapy works by waking up your immune system to be able to target it doesn't fight the cancer, it strengthens your immune system to fight the cancer, which is the way our product actually works. Okay, yeah.
Very quickly, if you're going for radiation, go also for our AD Pro.
Oh yes. Okay, radiation. This is very good. All right, and we have a promo for AD Pro, right?
Yeah,
Yeah,
yes.
please make you okay. When you go for radiation therapy, there's a radiation burn, right? My father actually did cobalt-60 therapy, so his entire neck here is brown in color. All right, the skin is burned. I didn't have the product at that time. Now, for radiation therapy, the normal product that the doctor will give you is aloe vera. Okay, aloe vera will help keep the skin moisturized and help promote healing, but it will not be as effective as our AD Pro because our AD Pro is actually a probiotic, right?
Yeah.
It kills, I'll use the simple word. The action is not actually kill, the action is actually crowd, but I'll just use kill so that we can understand easily, okay? It kills the bacteria that causes the infection. Okay, whenever your skin turns red and becomes swollen, it's actually Staphylococcus bacteria. Our probiotic will kill that bacteria so that the skin can heal. All right. So it's one of the best things that you do. You just apply a thin layer, no need to have any thick layer. It's like water. So as long as it's wet, it's okay. 1-2 pumps, that's more than enough. Sometimes people feel, oh, it feels like melon water. So I don't know whether it's enough. No, it's not supposed to be like a mask. Okay, it's melon really very thin. It will help that the area that you're doing radiation heal. Okay, now how you use it is very simple, right? You put the AD Pro first. You put the AD Pro first, okay? Then let it dry. Okay. Why? When AD Pro dries, when you put the AD Pro first, okay, first clean the area, right? Okay.
Of course,
Then you put the
definitely.
AD Pro.
After
So
taking a
what
bath.
happens is that when you put the AD Pro there, the good bacteria will be now on your skin. And it will start to bully. It will bully the bad bacteria, okay? So it will kill the bad bacteria. Then you put your aloe vera on top of it. Let it dry first, okay? Because the aloe vera will moisturize and nourish the skin.
Right.
So you want to put the good soldiers underneath first, right? Then you put the tentage, you put the covering on top of the good soldiers, Meron like a protection, right? So that's how you use AD Pro. So if you use AD Pro, don't use your moisturizer before the AD Pro. Then you're putting a layer between a moisturizer. Then imagine this is your skin, right? This is your skin. Then you put a moisturizer like that. Then when the good bacteria come, it cannot reach the skin.
Yeah.
What you want to do is let the good bacteria
First.
go to the skin and live there. Then you put on top of that your moisturizer to protect the bacteria, the good bacteria in your skin. So that's how you use it. Eh? Clean your skin, put AD Pro, let it dry. It doesn't take long, maybe 1 minute, maybe even about 1 minute. Okay, and then you put your moisturizer to protect the area, and then that's it. All right. Yeah.
Excellent. Thank you. Thank you so much, sir. All right. Well, actually, that is our last question for tonight. And it looks like we've covered all our questions. So we're almost at the end of the webinar. As we wrap up this evening, we'd love to hear your final thoughts. Sir, next week is actually September. It's apart from it's the Pediatric Cancer Awareness Month. It's also the early Christmas here in the Philippines.
Oh, because it's the
starts.
Burman.
Yes, that's right. So I'd love to hear your final thoughts for our viewers.
Okay, I think Sheila is telling me to ask everyone to watch what you eat lang. Celebration starting. Okay, for those of you who know you want to enjoy your food, please, one helpful thing that you can introduce, two helpful things that you can introduce, right? Number one, take PPAR tablets even if you're not sick. All right. The reason is because if you're going to eat foods that are highly inflammatory, for example, all your candy and good food, preserved food, your spam, your ham, your honey baked ham, all these are a lot of processed food, right? So taking the tablets helps with the inflammation. So that's going to help you keep you healthy through the holiday seasons. You taking our Simply Nature PPAR tablets also increase your metabolism. So hopefully, I say hopefully because it will help you burn off the food that you eat. But if I tell you that, you will just eat more. Okay, so I'm not going to tell you that. Okay, and the next thing that you want to consider, you don't have to take every day. but you want to consider having some of our cleansing plus with you. All right, so maybe once a week. For many of us who work a 5-day week, then on Friday night, after a long week of hard work at the office, you come home. Then on Friday night, you drink cleanse. On Saturday morning, you wake up, go to the CR. Oh, success! Release yourself. Do that once a week. That will help keep you healthy through the holiday seasons as well. It will help you manage your weight and your health. And for the rest of everyone, thank you for spending this time together with us. It's been 5 years, I think going on 6, that we've been doing this program every Thursday. Normally I have Dr. Jansen with me. And it's wonderful because sometimes when I'm not here, you hear Dr. Jansen say certain things. When Dr. Jansen is not here, you hear me say certain things. The reason is because there's a reason why we do this program with me and Dr. Jansen, because we don't necessarily agree about everything, but we understand the mechanism of action. And okay, just give you an example, Lang. Which is a better color, red or blue? Both. Okay, I ask you, Lang, because this is maybe this is easier to answer, easier to understand. Which is a nicer color for Christmas tree, green or white?
I like the green one, sir.
Wow, we say green because it's natural, right? That's the way a tree should look, right? But some people like the white one because because it's not green, right? It looks like winter, and when you put ornaments on it, the color come out more. Okay, so me and Dr. Jansen are like that. I understand why white is nice, and I agree with him. When you put a red ribbon on a white Christmas tree, it stands out more than on a green Christmas tree, right? But green is nice. You know what I mean? So that's why, because we have different opinions, but yet we understand the strength of white and green Christmas tree. And this is why we do the program together. The places where we agree means do it. Both of us agree, right?
Okay.
The places that we have differing opinions, it doesn't mean that either one of us is wrong. There are actually two valid ways of approaching it, right? There are two valid ways of approaching it. See which one you prefer. Okay, both, we never really differ, right? It may be something like Dr. Johnson may say, hey, you take the PPARS the next day. I may say, hey, you take the PPARS that night. All right. So, but the end of the day, you still take the PPARS, right? So we both still end up with a Christmas tree, and you're still gonna decorate it. Okay, but there are some slight differences. Which one of us is more correct? Well, it depends on each patient. For some patient, my advice would be better. For some patients, Dr. Jansen's advice would be better. So we like to both come on so that we give people a choice, right? And because the protocols that we choose and we are talking about have a certain level of flexibility, you can actually try. You can actually try, right? So for example, chemotherapy. Dr. Jansen prefers to, for some chemotherapy, he prefers to not affect the efficacy of the chemotherapy, right? So he would prefer to say, okay, you don't take chemotherapy, you don't take Simply Nature PPARS the day and the next day. 2 days you don't take, and then on the third day you take PPARS liquid, right? For me, I have a different perspective. I would say, yeah, take it the evening, especially if you don't feel well. If you still feel strong after your chemotherapy, take it the next day, right? So, which one would work? Well, for a patient who's very strong or doing well with the chemotherapy, Dr. Johnson's strategy is better. Why? Because he totally doesn't affect the chemotherapy efficacy at all. The chemotherapy will be 100% effective, right? But if a patient who is more sensitive to chemotherapy, right, my advice might be better, because even though the chemotherapy effectiveness is reduced to 80%, but he feels better, he can actually continue with the chemotherapy. If he doesn't, then he may have to stop the chemotherapy, which is even worse, right? You get 0% if you stop the chemotherapy. So this is why on a program like ours, unless we have you standing in front of us, we won't know whose advice is more correct. right? So we give both options. We are both not wrong. Okay, and I hope you understand this so that you don't mistaken that how come when Dr. Jansen's not here, I will say one thing and then he's not. No, we do know there are areas that we don't completely agree, but we still agree with each other. That means, yeah, I understand where you're coming from, and he understands where I'm coming from. So it's really important for the patient to know where you are coming from, and then you choose between our advice. At the end of the day, we still take PPARS. We still go for whatever protocols that your doctor wants you to go for, and we'll support you through that. So I hope tonight has been helpful and that you've learned something. Thank you for supporting us, and thank you. We're happy to always have you, and see you all next Thursday. And please share with your friends and family if there's anybody confused about what to do with cancer, natural or conventional. Should I go for operation? Should I do radiation therapy? Right? I think you will find our program to be a great resource, because we will share with you the pros and the cons of every approach. And there's always a right combination for a person. Sometimes for patients, chemotherapy is a very powerful one. Sheila is a good example. Dominic went for chemotherapy, which saved his life, but he did it with Simply Nature PPAR liquid together at the same time. All right. So, okay, I'll hand the time back to Sheila. Thank you.
Thank you, Sir Sean. Thank you so much. Okay, well, once again, thank you for all your questions and for valuing our program amidst of your own health battles. On behalf of every patient here, we want to express our gratitude to Sir Sean Lim for pouring so much effort and heart to all our questions tonight. For those of you who wish to have a consult, please please message us so we could refer you to the team that handles and facilitates the consultation together with Dr. Jansen Kalalan. Now, keep informed and explore all available options. Don't forget to like our Facebook page, Simply Nature International, and subscribe to our YouTube channel, Simply Nature. This is also to make sure that you get updated with our latest promos, exciting online events, online and on-site events. Now, exclusive for website orders only. Of course, you can still purchase our PPARS liquid extract or PPARS powder extract with no shipping fees, free delivery. So whether you are ordering from Metro Manila or anywhere nationwide, you can still avail this free shipping promo. Once again, only available via website www.simplynature.asia. We have exciting exclusive promos. Please don't forget to purchase our PPARS liquid extract or PPARS powder extract and get a free AD Pro serum. On a tight budget, we've got you covered with the free venue mask included when you purchase any PPAR soft gel capsule tri-pack or tri-blister. This exclusive offer is available now via direct or via website. So grab yours today. Stop struggling with stubborn eczema, psoriasis, and acne. Get your AD Pro probiotic serum. This advanced formula is specifically designed to restore your skin barrier and rebalance stressed out skin. The best part is our buy one, get one promo. Yes, buy one, take one po ang ating AD Pro. So, it is only for a limited time. Grab your duo now on Shopee, Lazmall, and website. And of course, via direct here in our BGC office. Now, great news, because we have expanded our hours for a Saturday dose of wellness at BGC office. Visit us this Saturday from 10 a.m. to 4 p.m. for an exclusive advice with our resident pharmacist, Ms. Jhen Macanjola. Get expert pharmacist choice advice on boosting immunity and cellular nutrition to elevate your health journey. Even better, if you purchase our flagship PPARS liquid extract or PPARS powder extract on site, you get a free umbrella. Okay, so this exclusive Saturday only deal is perfect way to complete your regimen. So contact your client service officer now to secure your spot and claim your free gift. Okay, so we hope to see you next week for another episode of Simply Healed webinar. That is happening on September 3. Wow, September already, no? So that is once again, same day, same time, Thursday night at 7:30 p.m. Thank you for spending your time with us. This is Simply Healed webinar powered by Simply Nature International and Simply Healed Medical Group. And remember, your curiosity about your health conditions and your victories over cancer are what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night and God bless you all. Bye.